Today I'm going to go over how I was diagnosed with Ehlers-Danlos and how it's affected my life, and hopefully you'll share your experiences or you'll learn more about the disease. And stay tuned till the end, because I'm also going to go over 3 things that are unusual about me but actually are not affected or due to my Ehlers-Danlos. So let's just start maybe with things in my childhood that seem to have now been related that kind of make sense. I mean, so many things with me over many years now make sense. All of the weird stuff that doctors couldn't figure out, if I just attribute it to the Ehlers-Danlos, it kind of makes sense to me. So when I was little, two things that stand out when I was like a baby, just learning to walk and that kind of thing. My mom said that I just went from crawling to walking in one day. It was never like I crawled a little bit and then I started walking. It was I crawled and then I went to walking. And so I guess that's common with children with Ehlers-Danlos, but we never really expected or suspected anything, because as far as I know, either of my parents, it is an autosomal dominant disorder. So usually you'll know if one of your parents have had Ehlers-Danlos, but the problem is sometimes it can be de novo, meaning that it just occurs and you're the first one. So the problem is I was also diagnosed kind of late in life. And when I was talking to my physical therapist, who also has Ehlers-Danlos, she said that it's hard to tell if your parents have had Ehlers-Danlos later in life, because as you age, you tend to get more stiff, and Ehlers-Danlos is a hypermobility disorder. So I'm going to call it EDS from now on, because I feel like we're going to start like a drinking game with the Ehlers-Danlos. Every single time I say Ehlers-Danlos, it's going to be crazy. But so EDS. And so she said that, as you get older, the joints are not as flexible, so it's hard to say whether your parents had it or not. So that was one thing that stood out. And then also when I was little, I was never able to, my mom said I was never able to drink a lot at one time. So in order to allow me to get enough calories, I was never allowed to drink just water in my bottle. I could only drink formula or or eat something that had nutrients in it. I was not allowed to drink water, because then that would fill me up too quickly. And honestly, that has been something that has been this way my entire life. And it's kind of funny that I work with bariatric surgery patients, because as you've seen in some of my videos, or maybe as you know, gastric bypass, lap band, all kinds of bariatric surgery, gastric sleeve, bariatric surgery patients cannot take in a lot of volume at once. And I'm still like that. So a lot of times, I'll eat things that are higher density of calories, because I can't really eat and drink a lot at one time. So I tend to graze throughout the day. And I've just always been like that since I was little. So I don't know, I've never had a full GI workup, diagnosing me with gastroparesis, which is like a slowing of the gastric emptying, but definitely by symptoms I have it. And then lucky me, I had my first colonoscopy, 2 years ago? My first colonoscopy, it was normal, but she did say that I had a tortuous colon, which is also common, and I didn't know that, common in Ehlers-Danlos patients. Tortuous colon is basically like a redundant colon. I have like a larger colon than most people, and so it takes up more room in my stomach, and so things, kind of can transmit slowly, food, liquids, that kind of thing. So it can make me feel full. And when I was little, my mom always used to dress me in suspenders or overalls, because I had like a little bit of a bigger stomach than the rest of me. And so I could never find pants that fit me. So I was always in like dresses and sweatpants and overalls, which I continue to do. I'm always wearing dresses. I'm always wearing sweatpants. I think I was into athleisure way before athleisure was invented. So, and pardon my voice today, that's another thing. I don't know if that's related to Ehlers-Danlos, but I did have a vocal cord polyp many years ago, and so I do tend to lose my voice very easily. And I haven't even been talking today, but I do attribute that also to heartburn, which is also common with Ehlers-Danlos patients. So no matter what, if I follow as much as I can. I mean, I love chocolate, I love carbonated beverages. I can't say I love coffee, but I do eat before I go to bed. I mean, I'm not really the best heartburn / GERD patient, but I do tend to get heartburn easily, and it does definitely affect my voice. So I probably shouldn't have eaten before I did this video, but I did. So those were like the main, weird things when I was little that my parents really just, thought I was just unique, I guess. And then as time went on, when I was little, I was also diagnosed with scoliosis. Scoliosis runs in my family, so we weren't really concerned about that. But the thing that was weird is that they didn't want to do surgery on me because the orthopedic surgeon found that like my curve was unusual. It was like an S-shaped curve, so I had curves in different areas, and my bones weren't like fused, or they weren't ready to be mature enough in order to do surgery. That's just how I understand it. I mean, again, I probably would have paid more attention had we known about the Ehlers-Danlos at that time, and I guess I'm glad that I didn't have surgery, because I don't know if putting a rod in would have worked. But basically I was in a brace until college, because everything was so mobile, so hypermobile. So I was in a brace until college just to wait to see if the bones would kind of stop shifting. So those were some things. And then also in college, what I would realize, I can't even say just in college, but just growing up, I always injured myself. I always injured myself doing just like daily activities. I would move the wrong way. I would trip. I was clumsy, but I would injure myself just doing daily activities. I started running and swimming in high school, and I never really injured myself doing running or swimming, but I would injure myself like brushing my teeth, or doing something stupid like blow drying my hair. I can't even, that's not even a good example because I never blow dry my hair, but whatever, like brushing my hair, like doing daily activities, I would injure myself. And I was always so careful. And being a runner, I was always so careful to like stretch beforehand, wear the proper shoes, do all the proper things, the warm up, the cool down, never do too much. And I would get like these just weird injuries that none of the orthopedic surgeons or sports physicians could really figure out. And then just more so looking into that, then I would go to my podiatrist for all sorts of weird stuff, and he would always just be like, your big toe moves 360 degrees. And just tell me all these weird things, and just be like, your foot shouldn't be this flexible. You have a very high arch. The foot shouldn't be this flexible. He never actually said you have Ehlers-Danlos, but he would just allude to it by, your bones kind of come in and out of place very easily, and it was just kind of odd. And then what happened was I had a foot injury, and no one could figure out what it was. So this was, gosh, I can't even remember, but it was like 2003 maybe. And I was in medical school, and I had this really weird foot injury, or I was actually in my residency. Really weird foot injury. And all of a sudden, like, I was just walking one day, and I think I went up the stairs, and I felt this pop in my foot, like at the base of my fifth toe. And so, of course, being, a medical student or a resident, I was like, oh my gosh, I have a fracture of the base of my fifth metatarsal, which, if any of you know, that's a really bad fracture. And they put me in a boot, and they did all this imaging, and they could not figure out what was going on. And then it happened with the other foot. Because I was in a boot, I was walking funny and compensating. And that's one thing that I noticed with Ehlers-Danlos is if I injure one thing, then it's like a whole cascade of things that get injured after that, because you're compensating. And my body is just not good with compensating. So then the other foot, the same thing happened. I felt like a crack, and the same thing happened. So I was actually in two boots. And again, did imaging. It just showed like a little bit of abnormal signal in the MRI, bone edema, meaning there was just inflammation. but nothing that could explain my intense pain. And I have a very high pain tolerance, and that's another thing with Ehlers-Danlos is, and I'll talk about that coming up. But so I had, intense pain. They did like bone scans to see if there was a fracture, and there was nothing. And then I went to 2 podiatrists, and the first podiatrist, this was actually maybe after this injury, I think. And what was weird was, I still had a lot of foot pain. And what was weird was that standing gave me a ton of foot pain, but like walking and moving, just constantly moving, running, walking made me feel better. And then he did all these tests on me, and he's like, has anyone ever told you that you have Ehlers-Danlos? And I'm like, no. And ever since he planted, thank goodness for that podiatrist, because ever since he planted that seed in my head, like everything up until that point made sense. So this was after that injury. So let me just backtrack a little bit. So then I went back to my podiatrist that had always alluded to all these things. And he's like, let's get a motion MRI. So he got a motion MRI, and then that's what really showed the fact that my cuboid, which is a bone that's at the base of your 5th toe, was subluxing. So it was going in and out of place, and then that's what was causing all of this pain. Because obviously, like, your bones aren't really meant to move that often in and out of place. So it was dislocating and subluxing. And so between the motion MRI and just him doing a few maneuvers, he did these little maneuvers, and then actually, like, the pain was gone. So after spending a year in bilateral boots, the pain was gone in both of my feet. The problem is then I had to strengthen my feet, and I always have to strengthen all of my joints in order to keep them from subluxing and dislocating. So, same thing happened and continues to happen with my shoulder. Again, when I was in the boot, I went to reach for something and herniated the disc in my neck because I was driving. I drive stick shift, so I couldn't drive stick shift when I was in the one boot. So I went to like pick up the boot in a weird way, and then I herniated a disc in my neck, and that was due to just being hypermobile in my neck. And I continue to, have that problem, and then dislocating my shoulders. So with me, shoulders, neck, and toes, those are the main things that, I really have to like continue to do my physical therapy every day. And then that's what keeps my joints, as good as they can be. And I think that's the most important thing with Ehlers-Danlos is just recognizing these things and trying to stay as strong as possible. What else? So the tortuous colon, I'm just looking at my notes. So another thing was I would always go to the dentist, and I just constantly needed more and more anesthesia. So he would like give me anesthesia. He would, do the lidocaine Novocaine. Yeah, Novocaine. He would go, put the Novocaine in, and then it would work very quickly on me. He's like, are you numb? I'm like, yeah, I'm numb. And then he would like go and just get something in his office to do the procedure. He would come back, and then the numbness was already going away. So he had to use a ton of Novocaine on me, and that's very common with Ehlers-Danlos patients, that we metabolize drugs quickly, and especially Novocaine, going to the dentist or any kind of like anesthetic. So that was interesting, and that's never fun. But as far as I've had dental procedures without a problem, it's just I have to let them know when it starts to wear off, and they usually put the Novocaine in, do the procedure right away, and if it's taking longer, they know to give me more Novocaine. And that happens with other drugs too. I mean, just, I'm just a fast metabolizer of drugs. They hit me kind of quickly, and then the effect wears off, so I become tolerant to things easily. And then let's see what else happens. So I'm kind of like leaving the skin stuff for a second. Because that's why I started my channel. That's a big reason why I started my channel, and my love of dermatology and skin kind of things is because of all the skin effects of Ehlers-Danlos. And I have videos on that. So I think, that's most of like the joint stuff and the GI stuff. I noticed the joint and the GI stuff the most. And then just, I was just reading today about like the inability to relax. Like even right now I'm doing the video and kind of squirming. Because, you have to, I can't be in a position for a long period of time because then I tend to just get, I wouldn't say it's injured, but things start to hurt. So that's one thing. And so then, like I said, I started my channel and I started to learn more about the collagen effects of Ehlers-Danlos. And then that's when I realized that, all my life, I've been the kind of person who was very fair-skinned, but a translucent kind of skin. So people were always like, your skin is so translucent. I mean, you can probably see now, in a lot of my videos as well, like I have dark, I mean, you can see like the veins in my eyes. So that's how my whole body is. And, my legs, you can see the veins in my legs, my chest, my arms. And when you're growing up, now I think it's different because I think people embrace fair skin. And again, I have a video on this, but when you're growing up, with fair skin and everyone has this like beautiful glowing skin, when I was younger, glowing tan skin, I always try to like, sit out in the sun as much as I could, do sunless tanners, all these things just to make my translucent pale skin look more the norm. And, there was even a time where I went to tanning beds, and then I read more about Ehlers-Danlos when I was diagnosed, and I was like, this has to stop. I mean, I can't keep like destroying my collagen because we still don't know about this abnormal collagen. We still don't know so much about it, but obviously skin and UV exposure is not good for collagen in general. So started wearing sunscreen and all these kind of things, and then I then had this rash. This was after a really stressful time in my life. I developed a rash all over my body. They didn't know what it was. Took many skin biopsies, many medications, again, which were not the best for me because I would tolerate them. They would work and then they would stop working. So we had to try all these different medications. They had to put me on steroids for a year, which steroids are not good for people with Ehlers-Danlos because it makes you hyper. It makes you, I felt with me because it affected my muscles. I was much more hypermobile because my muscles got so much weaker and I couldn't support my joints. And so the joint instability got a lot worse. So when I was on the steroids, I had all sorts of, joint flare-ups. And so that happened and they couldn't figure it out. And then finally they determined that it was autoimmune urticaria. Again, with Ehlers-Danlos, this is not really understood that much, but they worked me up for mast cell disorders, which are common with Ehlers-Danlos. Finally, after many years, we got that under control, but that was scary as well. So now on to the more bright side of things. And then easy bruising. That's another thing that you always hear about with Ehlers-Danlos. So the weird thing with me is I could like walk into a piece of furniture and hit my, whatever, and I don't get a bruise. But something little, if I just like tap my hand by mistake, then I'll get a bruise. And I have mentioned just aesthetic wise in the past, I have gotten Botox. I did have a blepharoplasty. I have videos on that. Those are the only two things that I have done. I've done vbeam. And we'll talk about that also in a second. But the funny thing is like, I don't know if you can see here, but I still have this bruise from Botox like 2 weeks ago. And the needle didn't hurt. She used this really, really tiny needle, but yet I still have this horrendous bruise. So that's what tends to happen. I kind of get like bruises from weird things. I do tolerate Botox. I obviously metabolize it quickly. So I just tried Xeomin. I'll do a video on that possibly in a few weeks. I just want to see, how it worked for me. I can't really tell right now, but it seems to be the same for Botox. I'll just see if it takes as long. And I did do blepharoplasty. The blepharoplasty is basically a surgery that removes the excess skin on the eyelids. This was another reason that I was diagnosed. I was always going in for Botox because my eyelids were really heavy. And a lot of the dermatologists or plastic surgeons, I mean, I do work at a medical center, so we would just like go and, you know, have fun and go do Botox with the plastic surgeon. He was always like, you know, you have a lot of like excess skin on your face, on your eyelids. Botox can only do so much. You are going to need the skin to be removed. So I did that 2 years ago. I have a whole video on that. It went very well, besides the anesthesia, but my doctor knew about the fact that he needed to give me extra anesthesia. It did start to wear off towards the end, but I was, you know, I was fine. Again, I have a high pain tolerance, so I was fine. Surprisingly, I did not bruise much from that. So, well, maybe not surprisingly, because it wasn't like a small thing. It was like a major, you know, procedure to the eyelids. So I didn't bruise from that. And I do have scars. Again, I'm not sure if you can tell, but I do have scars that are a little bit more raised. And, you know, that is getting better, but it has been 2 years. But I'm very happy that I did it. I've noticed a big change, so that's great. Let's see, what else? And then vbeam I do for, I'm really losing my voice. vbeam I do for rosacea. I'm going to do a video coming up on an example of a medication that went bad. I was treated with 5-FU, which is Effudex, for an actinic keratosis that I had on my cheek. And medication, you know, worked great, but probably just didn't agree with me. I realized that it's better for me to have a procedure than to have medications as far as skin stuff goes, because you never know how a topical medication is going to interact with my kind of skin. So long story short, it's been 2 years since I did the Effudex, which causes a reaction on the skin to destroy the actinic keratosis. And I still have redness, which was then determined by skin biopsy to be scarring from the Ehlers-Danlos. So just abnormal collagen deposition after the destruction of that actinic keratosis. So that's that story. I'm going to do videos on that. But again, it's been 2 years that we're going back and doing the vbeam every 3 weeks to get rid of the redness. So I kind of just want to do a video when it gets better. But so those are the weird things that I have to say about the Ehlers-Danlos. I'm glad that finally I was diagnosed, because sometimes things are weird in my life. I don't know, you know, a few weeks ago I just had like nausea, and it's like, well, why do I have this nausea? Well, it's probably due to the Ehlers-Danlos. So that's why I have nausea. So I don't dismiss myself. You know, I have a doctor, my primary doctor all my doctors really understand Ehlers-Danlos very well. So I'm lucky that I haven't been the kind of patient that has gone through things where, like, I've had to deal with a doctor who doesn't believe my symptoms. I mean, the only time that maybe I went through that was when I had the orthopedic doctor that was like, there's nothing wrong for you. I don't know why your foot is hurting. You know, maybe that was an example of frustration with them not understanding. So that was definitely that was actually, yeah, that was pretty traumatizing, being in a boot for a year. But you know, that's probably the only example of a doctor that really wasn't like understanding. And now that I know, my doctors really understand a lot about it. And even myself, I mean, sometimes if something just doesn't make sense to me, I'm like, well, it's the Ehlers-Danlos, and I'm actually okay with that. So if you made it to the end, how long is this video? Almost 24 minutes of me talking. I'm going to add in some photos, hopefully, if I can figure out how to do that. Because, you know, with me, I'm very tech savvy, but for some reason, some of this editing stuff just still continues to confuse me. So 3 weird things about me that are not related to Ehlers-Danlos. I have something called, and I don't even know how to pronounce it, dystrichosis. I'm going to put the way that you spell it, but I have double rows of eyelashes. So that's another thing that makes me unusual. I have multiple rows of eyelashes. Again, I don't know, you know, if you can really see it, like if the focusing is working, but it always looks like I have eyeliner. My eyelashes are also very long, so it looks like I have eyeliner on all the time. You can Google some celebrities that have it as well. There are some men that, you know, the rumors are that they're always wearing eyeliner, but they're not. They actually have the same genetic condition. And it has caused me to have eyelashes that have grown in the wrong way and caused corneal abrasions for where I had to go to the eye doctor. But so yeah, so I have these double eyelashes. Looks like I'm wearing eyeliner. Currently, I am wearing eyeliner for videotaping, but in some of my videos where I'm not wearing any makeup, I do, I don't have eyeliner on. And I have really long eyelashes. I don't know if that's related to the double eyelashes, but that's something that I have. And I was a synchronized swimmer in high school, which I guess now, synchronized swimming is great for people who are hypermobile because your feet are basically like you're wearing the little feet, whatever those things are called. Obviously, I'm not like a swimmer. I was a synchronized swimmer, and I was a swimmer at a time, but those little flip-flop thingies that you wear, whatever those are called, it's basically like your feet are like that because they're so hypermobile. And then obviously your joints are really hypermobile. So I was pretty good at synchronized swimming. And I went to space camp when I was in 7th grade. So those are 3 weird things about me that are not related to my Ehlers-Danlos. Thank you so much for making it to the end of the video. Maybe, put down below something that's unusual about you or something that you liked about the video or something that you want me to talk about in the future. I had a request a few videos ago for pictures of me when I was little, so I will do that soon. And currently I am at, I always like to announce at the time of this filming, my videos are not always, I don't always put them up right when I film them, so they're kind of out of order, but currently when I'm filming this one, I'm at 78 subscribers. Happy for every one of you, and I hope that I continue to help everybody with Ehlers-Danlos or not Ehlers-Danlos, just talk about whatever. So enjoy the rest of your day, and I'll see you next week in my next video. Thanks so much for watching.